On the program today, we take a look at how COVID-19 differs from the flu, especially as the winter months draw closer. We get a first-hand account on what it feels like to have COVID-19 and how to cope with it. We also take a look at the shortages of personal protective equipment, PPEs, and the impact that it's been having on healthcare workers. So that's what's coming up on the program. But remember, you can share your thoughts with us on social media, and you can reach us on Twitter using @SABC Health Talk, or on our Facebook page, which is SABC Health Talk. I'm Peter Ndoro, and Health Talk starts right after this. PPEs, personal protective equipment, and that's been a big problem, not just in South Africa, but globally as well. This COVID-19 pandemic has literally taken a lot of countries by surprise in its speed, and therefore creating these shortages in PPEs. And this has become a concern. Healthcare workers, some of them feeling unsafe, and some not even wanting to work. But to give us a sense of what's happening on the ground and how this problem is being alleviated, I'm now joined by the Gauteng Health MEC, Dr. Bandile Masuku, via Skype. Thanks so much indeed for joining us. Welcome to the program. PPEs, it's been an issue, not just here, but globally. And I guess this pandemic took us a little bit by surprise. You've been trying to mitigate this. What have you been doing to try and get this vitally important personal protective equipment to your healthcare workers?
Good morning, and thanks for having us. I think the most important thing is that we have been preoccupied, I think, from the word go when we started, from the beginning of March. And when we are far in a better position than when we started. We are quite confident that the stocks that we have now, that we have been able to amass, can be able to last us close to 6 weeks. And we are receiving most of some of the equipment from the National Department of Health through donations. So we are quite confident that with the work that we have been putting through, continuing to put through, we will still have enough. Our aim is to have enough PPE that can be able to last us through the next 3 to 4 months.
Is the equipment out on site already, or is it still an issue of distributing them where they're needed?
At the current moment, we have been trying to make sure that the daily requirements in all facilities are met, and making sure that if there's any shortage, we are able to refill that particular facility. And it's something that we've been doing. We have launched a hotline, a WhatsApp hotline, which our healthcare workers outside the ambit of facility managers and everybody to be able to raise concern when they see that there's a big issue or the shortage of PPE. We also have got troubleshooting team that is always on standby to go around all the facilities across the province to fill it that need. So at the moment, I think we've made enough progress. It's not yet sufficient. I don't think we'll get to a point where we'll say we have sufficient. We must just continuously be at a point where we continuously procure and get a PPE for our healthcare workers.
You said you've made progress. Does that mean that some of our healthcare workers are still at risk? I mean, if I consider what's happened at St. Augustine's in KwaZulu-Natal, and then more recently, Morningside Clinic in Johannesburg, where 7 healthcare workers contracted COVID-19. Can this be attributed to a lack of equipment, or are there other issues at play?
I think it might be. It might not be the only factor of the equipment. Looking at the private healthcare sector, it's where they do have enough PPE. But we are going to meet with the Mediclinic group to understand what could have been the other factors. But the other important factors that are there, it's just people who don't take heed to the precautions that they need to have and to take before they see patients. And it's something that we must, with the labor unions, be able to continuously educate and train our healthcare workers in that regard.
Shouldn't it be standard that all healthcare workers should be tested as a matter of course?
Yes, it's a standard thing. We've already done quite a number of our healthcare workers in terms of screening and testing, because now we want to make it as almost a daily routine, particularly the screening part. We in terms of our mass screening, we've divided it into two as Gauteng. We are doing the hospital screening, meaning that we are screening everybody in our hospitals, in our facilities, and we also do the community one. So our healthcare workers are the most important ones that we need to protect and to guard against actual jealousy, because without them, we won't be able to fight this pandemic.
Where facilities have come short, what action are you able to take against them?
You know, like for us, we've been having a troubleshooting teams. Like I've said, there are 5 teams that are placed across the province, which are ready with some level of stock available on everything that might be required, your gloves, your mask and everything. So that when there is a call that comes in that in a particular facility, we do have a shortage, we go in and replenish actually that stock. Because that's the only way that we can be able to get on top of, of the problem. If we respond immediately and we don't take time and we don't take through processes that we normally have in the bureaucracy.
I was watching a WHO briefing sometime during the week, and one of the issues that came up was that because this pandemic came and it came in its numbers, that perhaps one thing that was neglected was training staff that are not normally in these kind of environments, training them up to be more careful and being more cautious in terms of exposing themselves. Is that something that's being rolled out much more?
Yes, I think since we've started at the beginning of the year, that's the training that we've been doing, particularly starting with those who are particularly in the front line, which are the ones that works in our casualties. And this is a training, remember, as health professionals, some of the things that we need to do, continuous actual professional development, and this aspect was one of them. And 2 years ago, we were in a space where we were preparing for an Ebola actually type of situation in our country. So we did also some level of training in that regard. So yes, it's different type of outbreaks, but some of the principles still remain. And this is something that we need to. So we have been doing it. And now the other training that we're doing is also the where to use what. That's the other important training, because when you cannot demand a PPE that is used in ICU when you work in the reception or in the triage area. So now we are undertaking that particular training and education amongst our healthcare workers so that people understand the amount or the minimum amount of PPE that they require where they are stationed.
How much engagement have you had with the NAHAUs of the professions? Because they've been concerned and were threatening to take you to court. With the stocks that you've been getting, I saw that this week you got quite a significant help from the Bank of China. Are they feeling a bit more assured now?
Yeah, I think they did take us to court, Peter, and the judge, we had to demonstrate to the judge the amount of work that we've been doing, the amount of stock that we're having, and the judge took a decision, an objective decision of the work that we've been doing, that this is actually sufficient. And the demonstration of the effort was also there. The proof of the effort was also there. So we are doing quite well in that regard. In Gauteng, we've been having weekly steering committee meetings with Labour, where all our labour unions are actually represented, where we discuss issues that relate to OHS. As we are speaking now, I'm going to go into a meeting with NAHAU in the province also to be trying to deal with these issues. But the whole aim is to try to get cooperation and have a joint program of education and creating awareness, and also a joint program on monitoring the stocks that we have.
All right, and I can imagine being on the front line and working this closely to the virus can cause tensions, fears. Are you working with your healthcare professionals in terms of, I don't know, counseling them and trying to help them through this?
That's one other aspect. Besides that, I've been with them in most instances because I don't want to be the type of leader that leads from aircon offices or boardrooms. So I've been in the ground. I'm still going to join a whole lot of testing sites where we're going to be doing that because that's on its own demonstrate the understanding. But the other part is that we are organizing with partners that we have, a bit of counseling and a bit of motivation and also a bit of wellness programs, particularly at this time, when we're dealing with the pandemic. At the moment, we're still on the fortuitous side of things because we have not hit the peak, but we need to start doing the basics right at the current moment. When the peak hits us already, it's just second nature.
All right, so just before we start wrapping up, I just wanted to get a sense of where we are in terms of testing. I know nationally we're at about 87,000. Gauteng, the epicenter of this virus in the country. How are we doing in terms of ramping this up? I believe we've switched now from passive detection to more probative and trying to find the disease. How much more do we need to do per day, for example, to get to the levels where we're comfortable that we know the size of the problem?
In Gauteng, we currently have screened more than 100,000 individuals across the province, and we have tested close to 2.5 individuals, which the results have actually indicated that we have not found anyone who's positive in that group of results that we have had. So the whole thing that is just pulling us back at the current moment is just the availability of the rapid test kits that will help us, in a sense, to improve our screening and improve the uptake of those who might actually require to be tested.
Where are those kits? I heard the minister talking about them arriving last week.
They have arrived. Remember that they have to go through the regulation, the SAPRA regulation, which we are putting pressure on them that they must now give us the permission to use them because this will help us in the next 2 weeks to be able to come to the figure that is closer to decent in terms of testing. My figure in Gauteng, as we look at it, I'm thinking that we need to at least do almost 3 million tests by the end of this lockdown, but I'm not sure if we'll be able to if we don't have these rapid test kits.
All right, and then perhaps finally, to mask or not to mask, and I guess you're encouraging us to wear cloth masks so that these clinical masks can be given to professionals.
Yes, I think that's the most important thing. I had to concede to the broader majority in the discussion because I was one of those who were arguing that ordinary people who are not infected shouldn't be wearing masks because it also gives you a sense of false security. But I think if we use and we continue to use and create awareness to use the masks appropriately, maybe we'll get the actual results that is intended. But let's reserve those that are surgical masks and N95. Let's reserve them for healthcare workers. And then most of us who are civilians, we can use cloth mask. I already have mine, got my family a couple. So it's an important thing that we need to do, and we're hoping that it will help us. Remember that we are trying to create a hybrid type of model of response. So looking at all the other countries' experiences, we have realized that wearing a mask has played a role, doing massive testing has played a role, and also instituting social distancing has played a role. So we are trying to create a hybrid, a South African model on how we can be able to respond. And I think that's why even the results are not showing a typical pattern like in other countries. It shows a very unique pattern of the spread of the disease.
All right, Dr. Masuku, thanks very much indeed. Always a pleasure talking to you. And we wish you the best of luck with this good fight. Thank you so much.
Thank you, and thank you for having us, and let's talk again soon. Thank you.
Thank you so much. All right, so that's the MEC for Health in Gauteng, Dr. Bandile Masuku, sharing his thoughts with us about personal protective equipment. And remember, you too have a PPE, and that's that mask. Wear it all the time. As soon as you leave the house, have a mask on, because if you're protecting others and others are protecting you, then we can manage this COVID-19. When we return after the break, we continue with our discussions around personal protective equipment, particularly how it's affecting our workforce in the healthcare arena. Stay with us.
What we are working on is 2,154 beds in the province, which will also include the repurposed beds. So that's the one category that we have. We have a hospital that we have in the province called, it's a new hospital, we've not utilized it. It's called Pixley Kaisaga Seme Hospital. Out of that hospital, we are going to get 450 beds.
All right, welcome back. If you just joined us, you're watching Health Talk, and today we're exploring a number of issues, and one of them is the discussion we're having on the shortage of personal protective equipment and how that might be contributing to the risks that some of our healthcare workers are facing. Well, let's now go to KwaZulu-Natal, and you'll remember St. Augustine's Hospital was one of the centres of concerns there when a good number of healthcare workers tested positive for COVID-19. Our reporter Simpiwe Makanya is there. He's been following the story for us, and let's get a sense from him what the situation is like now. The hospital's pretty much closed, I think, for maybe one ward.
That's correct, Peter. About 2 weeks ago, St. Augustine Hospital became under the spotlight here in the province of KwaZulu-Natal when it emerged that about 47 health workers from this hospital had tested positive for COVID-19. The provincial government, after those revelations, decided that there should be an investigation to discover what exactly may have led to such a high number of infected health workers in this hospital. But Peter, it's not the only hospital that has been, facing challenges. Public hospitals as well in the province of KwaZulu-Natal are facing quite an immense, a challenge when it comes to the issue of COVID-19. And to talk to us about some of those concerns, I'm joined by Mr. Mlungisi Ndlovu, who comes from the union PSA. Mr. Ndlovu, thank you very much for your time. Perhaps as the union in KwaZulu-Natal, are you happy with the interventions that government has put in place in terms of addressing the issue of COVID-19?
One of the things that we should appreciate as PSA is what Dr. Zweli Mkhize has done at the national level in terms of providing policy directions to all the provinces. We've got challenges in KwaZulu-Natal. One of those challenges is the issue of the shortage of the PPE, where our members are forced in different hospitals to work without PPE. If you look at the incident of the Netcare, we are very concerned as the PSA, because once you start having frontline workers infected with COVID-19, it's become a challenge. And the biggest challenge that we have as PSA is the lack of cooperation between the HOD of the Department of Health, Dr. Shabalala. It concerns us because we have written letters of concerns where you've got cases like Inkosi Albert Luthuli, where there was one case of confirmed COVID-19. A patient came from private hospital with no emergency condition. He was transferred to Albert Luthuli without proper following the proper protocol. But what happened is that one of our staff members was infected with the COVID-19. Now we then called for hospital to do the testing. They've done that particular process. We are very concerned in terms of the level of the readiness, because Dr. Zweli Mkhize has provided the policy direction, but there is a lack of communications between the department and organized labor.
Let's zoom into those issues of concerns that you have highlighted, Mr. Ndlovu. One of them, of course, being the issue of PPEs. Dr. Zweli Mkhize was on record saying that health workers must not risk their health and treat people who are suspected of having this virus without any protective gear. Is that the situation on the ground?
Yes, we've got a challenge on the ground because what is communicated by the MEC to say there are no shortage of PPE in KwaZulu-Natal, we believe that the MEC is misinformed. It is for this reason that we want to engage with the MEC. We've got challenges at Potchefstroom where they don't have PPE. We've got challenges at Nkandla. We've got challenges at Shabisa. We've got challenges at Nanda Clinic, Escort, Grace, Madaden, and many other hospitals where our members are forced to work without PPE. For example, in Grace, we heard that on the 23rd, EMIS, they were forced to take care of the patient with COVID-19 without proper PPE. Those 8 people have been charged. So what we're saying, the challenge that we have is the arrogance of the CEO in different institutions. We are ready to work with the department. We support all the initiative, but our concern is when the institutions, they are not providing with this PPE, they are not providing with transport, they are bullying. The level of bullying in KwaZulu-Natal in health institutions, they have increased. What we're saying as PSA, we want to put proposal to the MEC to say these are the things that need to be done, because we expect every institutions to have a command team that include organized labor, because you can't tackle the issue of COVID-19 without proper PPE. We believe that PPE is the first line of defense in terms of providing to our workers. We've got this particular challenge on daily basis as PSA. We receive these issues, but we are calling upon the MEC Nomagugu Simelane. We're going to make this noise until she meets with us. What is happening in private hospital is also happening in public. Our main concerns with regard to the Netcare, some of the doctors that are working here are moonlighting in different hospitals, your Albert Lutul, because these are the specialists. The question is, what is the plan in terms of testing these doctors to ensure that they are not the one that transfer the COVID-19 to our frontline workers?
Mr. Ndlovu, one of the issues which we have raised is the issue of the protective gear. And speaking of which, about 2 weeks ago, we had quite a few incidences where healthcare workers were actually picketing inside their various health institutions, demanding to be given those PPEs. And one of the things you said was that you cannot actually let your members risk their health by actually working without those essential tools. And the minister also was on record saying that actually they have done everything that they can, but there's a global challenge when it comes to the issue of a shortage of PPEs.
So we're very excited about what Dr. Zweli Mkhize has communicated. He has confirmed our position for PSA, because remember, it's an issue of compliance with OSS in terms of Section 8 2B, that employer must make work environment conducive. And Dr. Zweli Mkhize has confirmed to say no workers should be forced. And our view is that they can't go on strike because they are essential service, and they can't down tools because we don't have those particular tools. So it is for this reason our message as PSA to our members is said, continue to work hard. We recognize the work that you are doing, but if there are no PPE, if there are no protective gear, you cannot be forced to work in those environments, because the law is very clear. You can take reasonable instruction, but if the instruction is unreasonable, we cannot allow our workers to be exploited in that particular way. It is for this reason that we are calling on the MEC. The MEC must come forward. They must give us a stock level of the PPE in KwaZulu-Natal. They must indicate how long those stock level it will take, because it will be fruitless to fight against this pandemic called COVID-19 if they don't have the PPE. The other things what we are saying, they must avoid to have secret environment where they are not communicating information. The last time the MEC communicated to the public that Grace Hospital, Editing Hospital, Gwelezane Hospital, and King Edward, those are the hospitals that must be take care of the COVID-19 patient. But we're getting information that almost all the hospital and health institutions are starting now to screen. We are saying they must come up front so that we check the level of readiness. They must indicate and show us the document.
Okay, Mr. Ndlovu, due to time constraints, we'll have to hold it right there for now. That's Mr. Mlungisi Ndlovu. He speaks on behalf of PSA here in the province of KwaZulu-Natal. Peter, it's back to you in Johannesburg for now.
Simpiwe Makanya, thanks so much indeed. That's our reporter on the ground there at St. Augustine's Hospital, just outside that hospital, of course, where so many healthcare workers there contracted COVID-19. So we've heard from the authorities, yes, it took time to get this equipment to the healthcare workers, but this has improved, and they'll never have absolutely enough, but certainly they're doing their best to make sure that they're protected. All right, well, let's continue with this conversation, and what we'd like to find out now, and we're going to get the take from a clinical psychologist, Charity Mokone, who's going to tell us a little bit about what it feels like for the healthcare workers, what they might be going through given this shortage of equipment. Charity, thanks so much for joining us. Welcome to the program.
Thank you very much for having me, Peter.
All right, so when we hear the union leaders speaking on behalf of their workers, they're quite passionate and trying to protect their workers on the front line. I'm just wondering, you know, from a psychological point of view, it's hard enough just being in that environment, and it must be extra strenuous if you don't feel like you've got enough protection.
Certainly. I mean, it is just hard enough being in a caring profession where your core job, what you are doing, is looking after other people and ensuring that they are safe and that their well-being is taken care of. That adds an additional layer of stress to anyone's life who is in a caring profession because of the sheer pressure that is on you to be able to keep others well and healthy. And I think what has been introduced by the coronavirus is that there's a level of lack of immunity, meaning that no one is immune to it, everyone is affected, and there isn't any type of thing that you can do to try and protect yourself from it or to not get it. So I think the anxieties of healthcare workers at this moment are justifiably so heightened because of the level of risk that they're placing their lives in, and also perhaps a lack of acknowledgement for the psychological stresses and the psychological pressures that they carry just in their jobs, in their everyday jobs, but more so with this pandemic and this virus.
Might that affect their ability to do their best work?
Indeed. I mean, certainly, because when you are operating from that level of anxiety or that level of uncertainty about what happens, that it's not just you. I think with the virus, what adds on to this is not that as a healthcare worker, you're not just the only person who's impacted by this, that you might, if you are exposed and are infected, might carry that virus to your family, to your loved ones outside. So I think that does indeed put the healthcare workers in a position where they're fighting for their own lives and fighting for their own livelihoods, and also trying to protect not only themselves, but their families and people at home. So that becomes very difficult because they're preoccupied with a sense of staying alive themselves and a sense of keeping themselves safe. So it leaves a reduced capacity to be able to look after the patients and look after the people in their care at the hospital.
So I know that people like you, clinical psychologists, often shrink each other because you kind of need to unpack some of this stuff that you're constantly exposed to. I would imagine that it's pretty critical now that more than ever, healthcare workers get some kind of counselling through this time.
Absolutely crucial. I think it is the backbone of what will keep them going during this time. Because like the previous interviewee was speaking around them not being able to down tools, that option is not available to them. And because of the virtues that they have and their professional ethical obligations towards the job, it is something that they want to do. It is something that is needed from them. But I think it's to keep in mind, for the population to keep in mind, for the powers that be to keep in mind that they are human too. And they have lives, they have families, they have fears as well. And I think to frame this pandemic as a traumatic event, it is a trauma that we're going through globally, and that in a crisis, in a time of crisis, in a time of psychological trauma, there needs to be a lot of support, because you capacitate those who are in the front line by giving them psychological support so that they're able to carry on and carry out their duties and the job as is needed.
Okay. All right, so let's chat a little bit about, let's say I'm a healthcare worker and I come to see you as my clinical psychologist. Typically, what kind of things would you be taking me through to help me get through?
I think the first thing to start off with, which I think is something I just mentioned now, is to register this whole pandemic, this whole crisis time that we're in as a trauma. So part of the work, or a major part of the work that we would do, would be trauma debriefing. So the trauma of having or being in the front line and having your livelihood and your life threatened on a daily basis, because you don't know what's going to happen. This is an invisible illness which has caused and is continuing to cause and wreak havoc on a lot of people. And I think then bringing it down is to think about your loved ones, because I do think that a lot of healthcare workers are really worried about the risk that they're carrying home to their loved ones and their families and friends and people who they interact with when their shift is over and they go back home. So I think it's a double burden that they're carrying in terms of fears for their own lives, which can be quite traumatic, because it's a matter of life and death. Even though they have information in terms of the factual information around what it means, I think the knowledge of being exposed, particularly if there is a lack of PPE and equipment to protect you, that you're living with the knowledge that each time you go to work, you are risking your life. So you can imagine that feeling feels like being in the front line of a battle or of a war, that you might come out victorious or it might not be. And I think if the risk is not just for you as the healthcare worker, but stretches to your family, to children, to the people that you live with, it's very difficult, and it really does place an emotional toll on the people who are having to do this. That for some reason, I think there is a notion that healthcare workers should be able to, or ought to be able to, deal with this very differently from the rest of the population, and that there's a lot of their humanity and a lot of their humanness in terms of their own fears about the virus that's taken away from them. And I think the knowledge that they're not immune to catching it and not immune to not spreading it to others that they come into contact with makes it very frightening. And to work in a state of anxiety or a state where you're frightened is very difficult, because then you can't think, you really can't even have empathy for the patients who are coming in, who are needing your care, if there isn't any empathy extended to you. So what I would do simply is to offer the empathy and give back the humanity to these healthcare workers.
All right, Charity, stay on the line, because we're going to chat to you in a short while about people who have tested positive and what kind of help they might need psychologically. So stay with us for that. And so please stay with us. You're watching Health Talk. Coming up, a first-hand account of what it feels like to actually have COVID-19, and also the differences between flu and COVID-19. Welcome back. You're watching Health Talk. Now, over 2 million people have been infected with COVID-19, with over 130,000 deaths. But how does this compare with seasonal flu that COVID-19 is seen to be similar with in some ways? Well, if we take the US just as an example, in this current winter season, influenza has caused an estimated 38 million illnesses, 390,000 hospitalizations, and get this, 23,000 people have died of influenza in the US, and that's according to the Centers for Disease Control and Prevention. Well, with the winter cycle approaching here in South Africa, we're asking just how similar or different is the flu from COVID-19? To help us, I'm now joined via Skype by anatomical pathologist Dr. Nontobeko Mbata. Thanks so much for joining us. Welcome to the program.
Hi, Peter. How are you?
We are great, alive, and still COVID-free. We keep our fingers crossed. But now, before we even start talking about influenza and versus COVID-19, there is a difference even between flu and having a cold, because I think a lot of people think that a cold is flu, and it's not quite the same thing, is it?
No, it's not. So a flu is a viral infection. It's a specific influenza type of infection, and it's a virus that infects you. A cold is usually more a bacterial type of infection, but not a viral infection.
All right. So now that we've cleared that up, let's now start to try and compare the two, COVID-19 and influenza. What are the points that are similar? Let's start there.
Okay, so to try and assist people in understanding what the differences are, the first thing we have to understand is that they are both viruses, so they belong to viruses. And there are different types of viruses. The flu virus belongs to a group of viruses called influenza viruses, and the COVID-19 belongs to a different type of group of viruses called, or under the bracket of coronaviruses.
Right.
So there are other corona type of viruses, so such as SARS and MERS. Those are all grouped under coronaviruses.
And are they both respiratory in their effect?
Yes. So flu virus, the way that you acquire it is similar to the way that you acquire the coronaviruses, and they do affect the respiratory system. However, the symptoms are also quite similar, and the difference is in the virulence of the viruses.
All right. Let's talk a little bit about things like incubation and contagiousness. Influenza, can I pass it on?
Yes, you can. So, for example, a lot of parents can relate to flu because if your baby in creche catches flu, the whole family catches the flu. So you can pass on flu from one person to another person. However, their incubation periods are slightly different. The incubation period for flu is 1 to 4 days, and the incubation period for coronavirus can be up to 14 days. They also do have similar symptoms. However, the symptoms initially for COVID-19 include fever, a cough, fatigue, and shortness of breath. Flu can be a bit more non-specific because you can get the above symptoms, but you can also get something. You can get body aches or body pains. You can get a headache, and you can get a runny nose or a sore throat.
All right. So, I'm quite worried watching this. 23,000 people died of influenza in the US this winter season. And I just wonder the risk profile, the kinds of people, is it similar in COVID-19? We hear about obesity, hypertension, underlying conditions. Are they the same for flu as for COVID-19?
Yes, in a way, you have to look at patients as if they're immunocompromised. Immunocompromised meaning that the ability of their immune system is compromised in fighting a simple viral infection like an influenza virus. So there are groups of patients who are prone to more severe forms of the flu virus. And also you must remember the flu virus, you can get the mild upper respiratory tract infections, and you can get a secondary infection on that, which can lead to development of something like a pneumonia. And pneumonia, as it is happens to be more severe in certain groups of patients, and those are the immunocompromised patients, like you've mentioned above.
All right, so a lot of people at this time of the year, we go and get flu shots. And this apparently helps us to deal with the virus when it comes. I know that it's not a cure, but I suppose it prepares the body to recognize the germs, the virus when it comes, and it knows what to do. Is it the same kind of pathology with COVID-19, that when this vaccine comes out that we'll have a flu shot, as in a COVID-19 shot?
So we have to establish the difference. So
Yeah.
the vaccine that we currently have is for the flu virus.
Right.
So that strain or that group of type of virus.
Yeah.
And the reason that we can have a vaccine is, remember, we've had the flu virus for many years.
Yeah.
It's been studied, been experimented, and they've managed to develop. So it's not something that just suddenly occurred. Also, in the development of flu vaccines, they look at certain patterns and the strains that occur to develop a virus, because there's a pattern in the way that the viruses occur. So that's how they determine what type of vaccine or what strain of the virus, of the flu virus, what strain is going to occur, therefore preempt and make an appropriate vaccine. On the other hand, the COVID-19 is a new type of virus. Nobody really fully, truly knows the extent of the coronavirus. There's very little known, and there are no vaccines for the COVID-19 virus. Okay. The discussion on the influenza virus vaccine currently is to try and prevent people getting two viruses at the same time.
All right, so is COVID-19 likely to be seasonal? We've seen SARS come and disappear almost. MERS the same. Is it going to be the same with COVID-19, we hope, or might it behave like influenza?
The honest answer to that is nobody knows. We've had this virus for less than a year. It hasn't gone through the whole cycle or through all the seasons. So we're only getting information from countries that have had mostly their winters. We haven't seen what it does during summer. We've had a summer and we didn't really have it. And now we're going into our winter and we don't really fully know what is going to happen.
Yeah.
So the honest answer is that nobody really knows what's going to happen with it, because already there are reports of reoccurrences in certain patients. There are reports of reinfection, but also in those reports, no one can fully explain what has really happened. It's all speculation, and people are trying to figure it out as we go.
All right, so we're going into this winter cycle now, and we're all going to have wheezes and sniffles, and we're all going to think we've got COVID-19. What's the best way to tell the difference now, so that we can, feel a bit calmer? Because we are expecting to have the med lemons and all these kinds of things out in their numbers soon. How do we tell the difference that actually, do you know what, I should go to the hospital?
So it's going to get a bit harder, because initially when we had it due to or related to exposure to people who have traveled, it was much better. But now, because we have spread within the country, it's going to be harder. But this is where things like testing of the population is going to happen, because they can then determine where the outbreaks are happening within the country. So if you have a flu and you are not getting rid of it, and you are in a place that has a high number of COVID-19 positive patients, that's one of the ways you can be suspicious. The second thing is that flu on its own does not cause a severe shortness of breath. So once you start having symptoms like shortness of breath and your temperature's high and it's not really coming down in a few days, you should get yourself tested. So testing is going to be encouraged. We do need people to test. We need people to voluntarily test. And it's going to get to a point where every testing is really truly open for anybody who's worried and would want to be. But just the gist of the story is that flu is a rapid disease. It's a few days, it's a day or two of high temperatures with chills and body aches. However, COVID-19 is a gradual disease. It develops over a few days and it's sustained over a few days, and it develops and becomes worse in severity.
All right. Dr. Mbata, thanks so much indeed for your insights, and we'll look forward to chatting to you again in the near future.
No problem.
All right,
Thank you so much.
Stay
Have
safe.
a good one.
Bye-bye.
Bye.
All right, so that's anatomical pathologist Dr. Nontobeko Mbata, helping us unpack the difference between flu and COVID-19. So shortness of breath, and also COVID-19 tends to be a little bit longer in its build-up and its effects, whereas flu is a little bit more rapid. We're going to take a quick break, and after that we're going to start unpacking what it feels like to have COVID-19.
Gauteng's got the highest numbers. About 80% of those numbers are in Johannesburg. So it worries us as a political leadership that people are not adhering. So I'm saying the first way is really to talk to our people. But the second is exactly what we're doing now here. Law enforcement is not only at the roadblocks, we're getting into the townships to enforce the law. In fact, people who are walking around here, some of them they've been taken through to police stations because they're just loitering in the streets.
Sir, you are under arrest. Yes.
Now, there are a few things that we know about COVID-19, how it's transmitted, and what are some of the more common symptoms of the virus. What we don't know is how each person will be affected by the virus, some managing to go through it with very mild symptoms, and others, well, getting very ill indeed. Well, on the program now, we try and explore what it's like to have the virus and what some of the psychological challenges might be in dealing with the disease. We have two people helping us with these insights. Joining me on Skype once again, we have Charity Mokone, who's a clinical psychologist, and on the line, and we speak to her now, is Naledi Radebe, who's been diagnosed with COVID-19. Naledi, thanks so much indeed for joining us, and thanks for giving us your time. How are you feeling?
Hi, thanks so much. I'm feeling much better than I was from the beginning. I'm feeling a lot more towards the direction of recovery.
All right, so we believe that you travelled during March. Is that what gave you the idea to go get tested?
Well, actually, I felt my first symptom.
Yeah.
And I was eligible to test because I had travelled. I think if I'd felt a symptom and hadn't travelled, they probably wouldn't have allowed it at that time. But given those circumstances, they were compelled to let me test.
All right, so take us through your journey from the moment that you felt symptomatic. You're hearing all this background noise of this thing called COVID-19. What was it like going to get tested and some of the anxiety you must have been feeling?
Well, around that time, it was literally the same day that the state of disaster speech had been given, which was the first speech by government. So at that point, I hadn't really been taking it too seriously. And then I felt the first symptom, and it was such a significant one. It was the shortness of breath. And, you know, if you felt a cough or if you had a fever, those are things you've kind of dealt with in your life before. But to have difficulty breathing or catching a breath is so significant. So I went to go get tested, and obviously the anxiety of the whole situation was just overwhelming because when you can't breathe, you just believe it's going to get worse and somehow you'll die of pneumonia overnight or something. But yeah, during the testing process, it was interesting because I suppose even my doctor he was not familiar with it, so he thought I had asthma.
Wow.
And so he prescribed me an asthma pump and anxiety medication. And kind of just the rhetoric around my reaction from everybody else was very much that I might have been exaggerating or that I was, I don't know, they couldn't see it because I was so asymptomatic.
Yeah. So take us through what then happened next to your body and what it feels like to actually have this virus doing its thing?
Well, I mean, I can say that I'm very lucky in the sense that I've been fairly asymptomatic. So the symptoms that I did start off with was a shortness of breath. And then later on, it developed during that week to 2 nights of kind of stiffness, where you wake up kind of feeling like you might have slept in the wrong position, or you went to gym for a billion hours or something. And then headaches would come in and out. And eventually I developed a cough, but it was more phlegmy. I think it was my body just trying to get rid of like the mucus within my respiratory tract.
Wow. And so you're on the other side of this now. You think the worst is behind?
I definitely believe that the worst is behind me. At this point now, I've been indoors for about 30 days.
Yeah.
So they said that the general period of time for this kind of thing takes about 2 weeks. But for me, it was like 2.5 to 3 weeks, really.
All right. So you know what? Stay on the line, because I want to get the word of a clinical psychologist on this conversation as well. And Charity Mokone joins us once again. Charity, again, we talked about anxiety for healthcare workers, but if you're not a healthcare professional, you don't understand medicine, and all you see is Peter Ndoro on TV talking about COVID-19 and death rates, it must be a scary thing.
Absolutely frightening. And I do think that it also, the anxiety is fueled on by the news reports that we've been hearing from Europe and other countries where the pandemic spread much more than it had here. So I think that added level of pressure and anxiety for someone who is infected by the virus as well as someone who is not, so the lay person on the street, is very frightening because of the consequences or the impact that the virus has had. So I think that becomes very difficult and cannot just be viewed as any other illness or any other sickness. And like Naledi is saying, that she did manage to feel better, that she's asymptomatic. So there are like people who have recovered and people who this is not tragic for. But I do think that the impact of the virus and how it's been reported on and the numbers going up each day and the impact that it's had on the world globally makes it very, very scary and also very anxiety provoking to be able to deal with in a rational and a very calm point of view. And
it's not just the individual, it's almost a family disease as well in the end, because it affects other people, doesn't it?
Most certainly, because I mean, with the normal flu or with the normal cold, yes, there is an potential for you to spread it or for someone else you live with to get it. But I think there is and also above the anxiety, an added layer of guilt that someone feels, particularly if someone traveled and they feel like it's because of the travel history and all those things. And I think it's that kind of wording and the way that we've been phrasing it and the way that it's put, particularly when it came to our country, in terms of the stigma that then follows, the guilt that the person carries from that.
All right, Charity, it's been a pleasure talking to you. We have to keep it short there, unfortunately. Thanks so much for your time. And Naledi, in about 10 seconds, what's your best advice for anyone who tests positive to get through this?
Again, like my doctor said to me, just treat it symptom to symptom basis, stay as calm as you possibly can. Even though it is not a flu, it truly isn't, you've got to try to treat it how you would if you had the flu. And most importantly, stay away from others, protect your family by protecting yourself, do you know what I mean?
All right, Naledi, thanks so much indeed for sharing your story with us. And that's where we come to the end of this week's edition of Health Talk. Thanks so much for joining us. Join us again next week at the same time. In the meantime, stay at home, stay safe. Bye, everyone.